Hi and hello everyone. Welcome back to my YouTube channel. And I know you have a couple of days to go before NEET PG, and that is why this video is very important for you guys. So I will really force you guys to watch this video. And we are going to be talking about a topic which I understand is controversial amongst you guys, and that is video-based questions for NEET PG. And it is going to be a one-shot video, and I'm going to be covering all the possible potential video-based questions that can come in the NEET PG examination. All right, you'll understand once I start with the style of the video as to how this is completely comprehensive, and it will put you in the correct mindset, and that will put you ahead of other people when you see a video based question in the INICT or NEET PG examination, or for that matter the FMG examination. All right, I want to put this across into your head, and I want you to understand each and everything that I say about video based questions. All right, so videos are nothing but fancy images. Please get my point, and you'll see it in my PPT that almost every video is just an image trying to show you something, right? So it's just a fancy way of concocting an image. And my hypothesis as to why NB included video based questions is that they are a good way to test whether you have done your internship or whether you have attended your clinical postings with sincerity, right? I'll give you an example. There was a question regarding echo. Okay, I have often sent my interns to accompany patients for echo, and a lot of them have asked me questions regarding what was there in the echo, and a lot of them has videos from those echoes in their phones, right? So it is a proof of concept of trying to test out ways. And as you know, the focus of the examiners, the focus of NB or the focus of NMC has been to test that, and that's why they are trying to implement next one and next two, right? So that is the point that they are doing. So videos are nothing but fancy images. So what you have been getting as image based questions, those are called as videos, right? Those are There's just a different way to present them, and don't think that they are something extraordinary, right? Second thing, as far as NEET PG and INICT go, everything is fair game, right? Remember, this is not a screening exam. This is an examination for your rank. So you cannot say and you cannot tell that no, I cannot do a video based question, or no, I cannot answer a question which is related to an echocardiograph, because this is an exam to select for the best. It is not an exam to select for mediocrity. It is not an exam to select for qualification. It is an exam which will rank you, that you are first, you are second, you are third. So that is the difference, and everything is fair game, right? Third thing, remember, in these questions, options are your best friends. So you will only be able to answer questions if you understand what is there in the options, and that will be very much from your theoretical aspect of things. All right, for example, if I give you a question and if I give you an echo and I ask you what is the diagnosis, you may not understand what is there in the echo, but the option, let's say option A is mitral stenosis. Option B, let's say it says mitral valve prolapse, right? So you may not be able to make out mitral valve prolapse, but you might be able to say, okay, that the valve looks narrow, so this is likely to be mitral stenosis. And the answer has to lie amongst those four options. So options are very important. Okay, you may not know what the echocardiograph of pulmonary stenosis looks. That is luckily not there in your options, right? So you have to stick to what is there in your options. Last, second last thing, these are not reels. You need not sit down in the exam and rewatch them, and you need not binge watch on them. Just see what is being shown, move on to the options, and then see if you are able to answer the question. If you are able to do so, do not waste your time in seeing the entire video or in seeing the entire gist of everything. Most of these can simply be represented as gifs or animated small animations, which can be 2 to 5 seconds also, but they may give you a longer one. Okay, questions here are going to be solved by intelligence, not by your knowledge. Okay, you may not have seen the exact same video before, but if you are intelligent, and that is what a good ranking examination selects for. All right, so with that in mind, let's go to the questions that can come, and let's go be it a little let's be a little exhaustive into this. So first off, we'll start with anatomy and surgery. All right, so that's a linked thing. So wherever they can show you a certain anatomical thing or an anatomical concept, I want to emphasize. Now this is where your intelligence will come into mind. All right, so for example, you are shown an operative video. and you are asked which surgery has been shown, if you're able to identify the region of the body, you will be able to make a calculated guess that whether this is a nephrectomy or whether this is a hernia surgery or whatever is being shown to you. Even if that is not the case, I'll tell you that there are only very few places where they are going to ask you questions from, and I would advise you revise these. So as you can see, I have not included videos for this in this session because these are essentially things that I can teach you through images. And when it comes into your exam, you will have the mindset to be prepared for these. All right. So it's all about making the mindset to solve video based questions. So if you get any question where you are shown a liver or where you are shown a laparoscopic image where you are shown these two laparoscopic instruments, they are almost always going to be showing you a lap chole, right? The surgery that they're going to be showing you is a lap chole. Okay, if they expect interns to have seen one surgery or to know about one surgery, it is cholecystectomy, right? Or lap chole. And in that, there is only one area to really ask questions from, and that is to ask you what is this triangle called as, right? That is called as the Calot's triangle. Okay, that is called as the Calot's triangle. You know the boundaries, you know the contents, you know cystohepatic triangle, right? I'll leave all that for you to go ahead and revise. But remember, if you see an image like that, that is most likely going to be Calot's triangle. And again, as you can see, this is not something that can be tested only in a video. But if you are shown a video of these two laparoscopic snares or these two laparoscopic instruments, along with that you are seeing something looking like the liver, more likely than not they're going to be asking about the Calot's triangle, right? So just look for that in the options. I'm not saying there cannot be other questions, but these are what things I feel are the most probable things to be asked. Second, if you give you a video of this kind of an operating field, what organ do you think they are operating near, right? And they have marked a structure, right? So definitely, if something like this is shown, you are able to visualize, I hope with me, that they are trying to show you a neck dissection and they have shown you the thyroid gland. And when you understand that it is the thyroid gland, okay, and if they're asking you about a structure, remember the important structure in thyroidectomy that they will usually ask you will be recurrent laryngeal nerve, right? So this is another question that can be put forward in this way, that they are showing you an operative video of a thyroidectomy and which of the following structures is at risk of injury. Like I said, be smart. If you're able to visualize and if you're able to imagine that the surgery or the procedure shown is that of a thyroidectomy, that is going to be recurrent laryngeal nerve. And in that sense, this video will be helpful to you in building that visualization. All right. Third thing, if I know nothing about a laparoscopic hysterectomy or a laparoscopic surgery, and I see something like a uterus, okay, try to differentiate. All these laparoscopic images otherwise will look similar to you. Try to see whether you are able to see a liver or not. For example, in this one, you are able to see a liver. In this one, I'm not able to make out liver, but instead what is very prominent is this peritoneum and the uterus that is going behind. So if you're able to see this kind of a uterus in the structure, they are usually trying to show you something from obs and gynae, and that will be very clear to you from the options as well. All right. So if you see a tubular structure, it can be the ureter, or if they're trying to show you something which looks like an artery, it will likely be the uterine artery, because that is the important relation that is present in this location. Okay, so at least you will narrow it down to two options out of four. All right. For example, your options might be ureter, uterine artery, cystic artery, and something else. So if you are able to recognize the area, at least you will be able to narrow down your options to two amongst four. That's why the answers will be very specific and the answers will be very clear, unless they really want to ask a very difficult question. All right. Another important thing I want to emphasize here is the other question that can be asked from here can be related to the ovary. They can show you a endometrial cyst, or they can show you black endometrial deposits. But again, try to understand all of these are basically image based questions which you have definitely read in your obstetrics and gynecology. Have faith in what your teachers have taught you, and do not be worried about the fact that it is a video based question. It's essentially an image which is fancy. All right. So these are the three kind of surgical questions I feel that can come. Now, practically, there is no end to what kind of questions can come in a video-based question. So it is actually very important you understand the pulse of these questions and not try to, tick mark or see how many ever videos you can watch. All right. So definitely, again, this is an image, but you can again be shown a video of the same. So winging of scapula is one question that entrance exams like to ask very frequently. What is the muscle involved? What are the nerves that are involved? What are the two muscles and what are the two nerves that can cause winging of scapula? That is what you should know about. All right. So winging of scapula can be another question that comes in your exam. Now, for example, they give you a video of a man doing pull-ups. So that's why I'm telling you there are infinite ways to ask a video based question. All right. And there is no limit to it. Okay. They can show you a man doing a pull up. Right. So you know the climbing muscle, latissimus dorsi. They may ask you what is the nerve supply of latissimus dorsi. Right. Or they may ask what is the nerve supply of the muscle which is used to perform this action. All right. So important thing that you basically need to remember is you can be shown a video. You have to identify the movement. Based on the movement, they may ask you to identify the muscle, and based on that, they may ask you its nerve supply. All right, they're unlikely to ask origin insertion for these things. So, important things you should know here is the important broad movements, the muscles, and the nerve supplies. In this, also, they are going to ask those muscles only which are important, those muscles only which are there in your previous year questions, like what is the action and what is the nerve supply of latissimus dorsi, or let's say serratus anterior or sartorius, which are the important muscles, and only these kind of things can be really shown to you in the examination. Okay, for example, the most common question that I expect is they will show you overhead arm abduction, and they will ask you which are the muscles involved in the first 15 degrees, that is your supraspinatus, followed by that your deltoid. Right, so how overhead arm abduction works you have read in great detail in your anatomy. So that kind of a question, if it comes as a video based question, you will be able to answer it very easily. Final one important question that can come is, and that is kind of a medicine anatomy kind of a mixed question, but I'll give it to anatomy, as to what eye movement has been shown to you. All right, so you can be shown a pair of two eyes which are looking to a particular side. Okay, they may ask you which muscle is involved in this kind of a gaze. Right, then you may be asked which is the nerve that is responsible for the movement. They may go one step ahead, and for example they may show you the right eye, and let's say it is not able to abduct here, it is not able to perform the abduction movement, and they may ask you which nerve palsy has been shown to you. All right, so they may ask you the defect also by showing you a pathological kind of a squint, or a pathological kind of an ophthalmoplegia. Right, so that kind of a question you can expect. So be very comfortable in knowing what are the movements of the eye, and whenever you see such a question, try to identify, one, whether it is normal or abnormal. Second, if it is abnormal, what is the movement that is abnormal, and after that try to localize it to a muscle and then to a nerve. And in this also, just remember, if they are asking about a nerve, the answer will always and always mostly be sixth nerve or the fourth nerve, because it is difficult to ask about the third nerve unless they are showing you a specific case scenario, or if they're giving you other information in the text. Mostly they'll ask either about sixth or fourth, and that also it is more likely to ask about the lateral rectus rather than the superior oblique. So these are some tricks that you can keep in your mind, and based on the options you can pick out the best answer. Okay, at last, one small concept, I think more related to surgery and trauma surgery. They may give you an image of an ultrasound. All right, and if you get an ultrasound, remember, I don't think it is expected for interns to be able to interpret ultrasounds apart from only one ultrasound that they should know how to interpret, that is fast and eFAST. So likely what you will be shown, and it will be very clear to you from the options also, will be an eFAST. So I only and only expect eFAST to come as an ultrasound image, if at all there is an ultrasound image which is not an echo, to come in the exam. And remember, it is more likely to be eFAST. So they may ask you, and if they have asked you something, it will likely be eFAST positive, right? So they may show you a video where somebody is doing a scan on a patient who is having trauma, maybe having a head collar. So that will likely be a eFAST exam, right? And then they may ask you a certain questions regarding what will be the next best step, right? What will be the next best step? And they'll be showing you something which is eFAST positive, right? So that can be a particular question that you get in your exam. Okay. Now, of course, coming to my subject, that is medicine, and you will realize now that medicine is actually the king subject for video based questions. So expect to have more questions from medicine, more questions from pediatrics, more questions from surgery, more questions from obstetrics and gynecology as the exam pattern becomes more clinical. That said, when you have more video based questions, and whenever you talk about videos, there are certain places in medicine where videos convey more than an image does, and that is kind of true for particularly for medicine. So I've given the most emphasis on medicine, and that's why I want to spend a little bit more time. I'll try to keep it short only. This is the one where everybody got crazy, and so echo, right? Echo. So of course you'll be able to make out a beating heart. I'm sure all of you will be able to make out that if an USG is shown to you, which is not an ultrasound, they're likely trying to show you an echo. So I want you to have a basic orientation because I think this is something where all of you are a little uncomfortable. There are three main views in echo: plaques, parasternal short axis, and apical four chamber view. Right? These are the three common views that we look out in the point of care ultrasound, and likely you will be given the apical four chamber or the parasternal long axis view. So basically, if you look at the heart, this is your heart. All right. If you slice the heart like a mango from here, okay, that is called as the long axis. If you slice it in the center like an orange or an apple, right, that is called as a short axis view. So if you're looking at the heart from a cross section which is like this, that is a short axis. If you're looking at it like a mango or a slice of a mango, that is a long axis view. Okay, if you keep the probe in the parasternal area, that is called as a parasternal long axis. If you keep the probe in the parasternal, look at the short axis, that is called as a parasternal short axis. These both will be perpendicular to each other. And if you keep the probe at the apex, that is called as an apical view. And in that, when you try to see all four chambers, that is called as an apical four chamber view. So I just wanted to build a schematic orientation for you guys to echocardiography. In that, what you do is basically, if you are shown the parasternal long axis view, it is very important. Mainly, what you are able to see in the parasternal long axis view is you can see a left atrium, you can see a left ventricle, and you can see the outflow tract. That is called as the left ventricle outflow tract, which is basically your aorta, your ascending aorta, left ventricular outflow tract. Above you might see the right ventricle. So important structures seen are left atrium, left ventricle, and the aorta. And remember, you will be able to see two valves. One will be the aortic valve, other will be the mitral valve. And in this, they may show you that the mitral valve is almost not moving, or it is very strongly coapted together. And that will be a case of mitral stenosis. So close your eyes, and if you get a plaques view, all right, and I'll show you, this is the plaques view. This is what the plaques view looks like. So you are shown the left atrium, the left ventricle. This is where the mitral valve is. You are shown the ascending aorta, and this is where the aorta lies, right? And here in this area is actually the pericardial space. And if you have fluid here, this will be a pericardial effusion. So these are the things that you can be asked to make out. So they can, if they'll give you a pericardial effusion, it will be a very big effusion, or they can give you a mitral stenosis, or they can show you a very big dilated LA, or they can show you something for the aortic valve. More often than not, they are going to ask about mitral stenosis, right? Okay. Parasternal short axis view is not very useful for you guys. So in the short axis views, you will basically be looking at the valves, and there are three levels at which you can look at the short axis. So in one view, you will be able to see the papillary muscles. In one view, you will be able to see the mitral valve, which is a bicuspid valve. And in one view, you will be able to see the Mercedes-Benz signs or the aortic valve, right? So you can see papillary muscles, or you can see the mitral valve, fish mouth appearance, or you can see the Mercedes-Benz of the aortic valve, right? Final apical four chamber view, nothing in this view. You will be able to see all the chambers depending on where you have kept the probe and everything. You will see the left atrium, left ventricle, and right atrium. And the thicker one will be the left ventricle. That is how you identify the left ventricle. There are other ways to identify based on where you have kept the probe, based on which valve is higher, the tricuspid or the mitral, but don't get into all that. So in this also, essentially what can be shown to you will again be something related to the mitral valve, or they can show you, right ventricle being very big, right ventricle dilatation or something like that. So you will make an educated guess based on the options. You need not know all the possible, echocardiographic findings. And my guess or my bet is that they will either show you a pericardial effusion which has a tamponade, because that is an emergency which is important for an intern to recognize, or they will show you a mitral stenosis, which will be a rheumatic heart disease case, which is the most common cardiovascular case that you get to see in a medicine ward. All right. So if you would have seen your postgraduates or your DM cardiology residents doing a echo, you will have some idea, some orientation. And if you guys are in your internship, do try to have a look at some of the how echo is done. So I've given you a resource here, the focusatlas.com. All right. So it's a place where they have provided an atlas of various echo findings. So you can check it out wherever you are trying to find a collection of images or videos or something, that is in medical literature called as an atlas. So if you want to search a lot of ECGs, that can be an ECG atlas or a focus atlas. So I'm just trying to help you guys in understanding what are the things to search when you are looking for a detailed library or a detailed collection of these things. All right. So I just wanted to orient you regarding a echo-based, video-based question. All right. This can be a full detailed video on how to solve a question regarding echocardiograph, but I don't think you'll be asked anything beyond this unless, the NB really wants to mess with you. Okay, again, you can get an ECG as a video-based question. An ECG has been coming as an image-based question for decades now, and you have gotten almost all types of ECGs in the INICT and NEET PG examination, particularly for electrolytes and myocardial infarction. As you can see in this ECG, there's a clear ST elevation in lead 3, lead 2, and lead AVF. That means it's an inferior wall MI. That means it's a inferior wall MI. It is showing you elevations. So again, you can be shown a video of the same. In a video, you just have to find out where is the image and what is being shown to me in the various leads. So this same thing can be shown to you as a video, but it won't make any difference because it is just an image. And where to study ECGs from, or where to get a collection or a library or an atlas, go to Life in the Fast Lane. There is a website by a emergency medicine resident. Now he's a consultant. Life in the Fast Lane. So it has a lot of collections. There's a library of the top 100 ECGs and all of that. So if you're interested, not for those who are appearing for the NEET PG in this examination, but for those of you who have time, right? Now, this is, I think, another very, very important and very underrated thing, which is very difficult to show in a single image. It is something that can be shown in two images or it can be shown in a video, and that is called as the respiratory paradox. So I understand that a lot of you may have seen this because in wards, when you see respiratory paradox in a patient who has weakness, it is a emergency, and this patient will likely require intubation because that patient has developed diaphragmatic palsy and is going to need intubation. So in this, there is a seesaw movement during inspiration. Your abdomen is supposed to go out, but here the chest goes out and the abdomen goes in, which means your patient is royally screwed. So you should intubate the patient. Respiratory paradox is an emergency. Again, I feel this is a very high yield thing to come as a, and this is something that is very difficult to show in a sole image, in a single image. So it is likely to come as a video, if at all you get to see it. Somebody had asked in the comments that regarding ventilators and ICUs and what are the settings and all. So I feel that is a very, very detailed topic, first of all, and it is not easy to cover it. Second, I feel it is not expected for interns to know how to troubleshoot or manage ventilators. They are more expected to understand the ABGs and the VBGs that are associated, right? So the common question that can be asked is that there is an ARDS patient that you are ventilating. The patient ABG was taken, PaO2 was 200. What is your next step? The answer will be to reduce the FiO2. All right. The answer will be to reduce the FiO2 because it will cause oxygen toxicity. I've already replied to a comment in the previous video. There can be a question on flow volume curves, but I don't think it is very relevant as a video based question. But I'll just tell you, for example, in this one, that what is happening is the expiratory flow is, what should happen is, so there are various curves that are shown in the ventilator, and this is the curve that we look at. This is the inspiration and this is the expiration. So whatever volume happens, it should touch the baseline in expiration. It should go and touch the baseline. Okay, and then you should start the next breath. If it is not touching the baseline, it is an indicator that either there is some leak or there is some air trapping that is occurring. And that is also again some sort of an emergency, right? So if this line is not touching, that is an indicator that it is having an incomplete emptying due to certain leaks, the circuit is disconnected, or air trapping is happening. All right. So I just wanted to show you this flow volume curve, or this volume time curve. And I just wanted to tell that it is unlikely for a question to come from this. And if something comes up, it would be likely very basic rather than being too much of a detail into how to interpret or how to manage or troubleshoot flow volume curves. Okay, maximum you can be asked is which mode of the ventilator is being shown to you, and that probably your anesthesia faculty have covered. So just have a look at what are the modes, what is pressure controlled ventilation, and what is volume controlled ventilation, and how will the curves look like. When are the curves smooth, and when are the curves kind of like a dolphin, or kind of like a having a triangular appearance, and which is the pressure curve and which is the volume curve. All right. Now, the most important area is perhaps in medicine is neurological examination. All right. Neurological examination. That is where you can be shown a lot of videos which are not, things that are satisfactorily conveyed by images. So you can be shown neurological examinations. And in that, very important thing that they will show you is Babinski. They will show you an up Likely if they're showing you, it will be an extensor Babinski. They will ask you what is the significance. Babinski is a multiple time asked previous year question and a previous year topic. So if Babinski is positive, it likely indicates it's a UMN lesion, right? So you can have certain caveats. They can show you someone who is doing the Babinski in a wrong way, right? So other things can be shown in a video, but mostly they'll, just be showing the clinical sign. Other thing that can be shown to you is a Clonus examination for Clonus. Again, Clonus indicates that it is a UMN, so it indicates that reflexes are extremely exaggerated, right? So mainly UMN signs can be shown to you. It is more because UMN signs are positive signs. Apart from fasciculations, which are an LMN sign, which is a positive sign, other signs which are LMN are actually difficult to show in a video because you cannot show depressed reflexes in a video. It will not convey any meaning. So if a question is asked whether the sign shown to you is a UMN sign or an LMN sign, mostly your answer will be UMN because fasciculations is the only LMN sign which can be shown to you in a video. All right. Other things that can be asked is knee jerk, ankle jerk, biceps jerk. So they can just show you one of these exaggerated jerk reflexes and they can ask you which reflex is being shown. What is the localizing value? For example, biceps is at C5, C6, right? So there's a popular mnemonic also that is given in your first aid, right? 5, 6, pick up your sticks. So that kind of a mnemonic is there as to what is the localizing value of each exaggerated jerk sign. But that is the other thing that I feel can be shown to you from the neurological examples. But I just wanted to show you Babinski and Clonus. If they're asking you simply and plainly what is the sign shown to you, this is going to be your answer. All right. Now, this is kind of like a pharmacology medicine kind of a question where they can show you certain routes of drug administration. They can show you certain routes of drug administration. So they can show you a person who is injecting themselves with insulin, right? That is the subcutaneous route of drug administration. And then they can ask you certain questions about insulin, and a new update here is that there is now a weekly insulin available by the name of a weekly, right? So new insulin, that is a weekly insulin, is now available in India, right? So subcutaneous route of administration, you have to rotate the sites and certain practical things. Then kind of a pediatric pharmacology kind of question, they can show you and ask you about spacers or inhalers which are relevant for asthma. And again, as interns, since you will be managing these cases, you will be commonly managing patients' diabetes, adjusting their insulin dose, or commonly managing pediatric patients and adult patients presenting with asthma, giving them nebulization, or advising them inhalers or spacers. I think this is again a very important area for all of you to be aware of. This can also be shown in an image, but just in case they end up showing it as a video. Then you can be shown a patient who is receiving oxygen. They can be showing you a patient who is receiving oxygen. They can show a patient connected to a cannula. They can show a face mask. They can ask you, they can put an NRBM mask, which will, kind of be like a balloon in front of the mask. Or they can, show you a Venturi device in the video. Depends on how clearly they are able to depict it in the video. And whenever, they are depicting these things, or whenever they are depicting these systems, they may ask you regarding the flow rates. They may ask you what is the FiO2 that they are delivering. All right. But mostly they'll ask you what is the oxygen delivery system shown in the video, right? This kind of a question can come. But again, it will be a slightly difficult thing to make out in a video. Now, this is, kind of my favorite part, which I feel is likely to be asked in your exam. They can show you movement disorders. All right. I think you are not able to see the GIF on your screen. And I'll just tell you that there is so whenever you want to search for something, there is a way to search these things. So you can get a video or you can get these questions as GIFs. So previously INICT has asked one or two GIF based questions. All right. It's not that it has not previously asked such questions. So you search for GIF. You put it in Google as, so like how I got this video is I searched for Hemiballismus GIF, right? And you will find this video. And this is a good hack because if you do this, you will likely get the exact video that will come in your paper. Suppose they end up trying to give a video based question or a GIF based question. So in this video, what essentially is happening is this man is rotating his uh, leg, right? So not rotating. I mean, there's a violent movement of his leg. So violent movements of one limb are called as hemiballismus. They are called as hemiballismus, and they can ask you that in which region of the brain, in lesions of which region of the brain do you get hemiballismus. So questions from movement disorders. So I will advise you go to movement disorders in your first aid. Go to movement disorders in your first aid, right? Open your first aid, go to movement disorders. In movement disorders, they have given you a certain list like chorea, hemiballismus, right? All of those things are mentioned, tremor. So, and you write hemiballismus GIF in Google and just have a look at those certain GIFs so that you have a clear understanding of how those GIFs are expected to look if they show up on your exam screen. All right, that is the hack I can tell you here. Then they can show you a video of Gates. They can show you a video of Gates. By Gates, I mean not Bill Gates. They can show you a video of a man walking. They can show you a video of a man walking in a certain way. Again, most likely question to come from movement disorders is Ballismus. Most likely question to come from Gates is Parkinsonian gait. All right. Of course, they can show you an alcoholic gait or a drunk man walking like an alcoholic, or they can, show you other gaits which will sometimes be difficult to identify. But a Parkinsonian gait where the man has a stoop posture will be instantly recognizable. So Parkinsonian gait can be a gait-based question. Again, I would advise you see the list of gaits. There are 5 or 6 only that are there. Parkinsonian gait, sensory ataxia gait, alcoholic gait, that is your cerebellar gait, and then Trendelenburg gait, right? Trendelenburg gait is particularly very, very important and has been asked multiple times previously. So just see how those waddling, lurching, those things will look like. And again, the way to search will be to write Parkinsonian gait GIF in Google, and you will get this very GIF that I am trying to show you. All right. So I feel this is one area you spend 5 minutes before your NEET PG examination, it will be worth it. All right. And again, these are also mentioned in your PYTs and PYQs. Now, this is one maneuver, medicine ENT kind of a place. So there are two maneuvers that can be shown. One is the Dix Hallpike, which is a diagnostic maneuver, which can be shown to you. It will have lesser number of steps. The more complicated one that I have shown in this image is actually the Epley's maneuver. It is the Epley's maneuver, which is used for benign positional vertigo, right? Benign paroxysmal positional vertigo, BPPV, right? So Epley's maneuver is the therapeutic one. Dix Hallpike or is the diagnostic one. Another diagnostic one for a different kind of a BPPV is roll test, right? So you can be shown Dix Hallpike or Epley's. More number of steps it is Epley's, less number of steps it is Dix Hallpike. So I would advise you to go through a video or you just have a look at the images like I have shown you in this slide. But you can search for Epley's GIF or Epley's video and you'll get a good number of videos on YouTube as well for this. Okay, this is just one I thought to add for the Gower element, so they can show you an endoscopy image and certainly you'll be like, what is this? And they can show you a blood spurting and they can ask you what is happening. So nothing, it's an emergency. That's why it's probably important. It's a UGI bleed and the classification used for it is the Forrest classification. Okay, probably taught to you in surgery. I have included it in medicine because it's gastroenterology who usually does the endoscopies. All right. So don't be afraid that I've been shown an endoscopy video or I've been shown this. Mostly the concept that they're going to try to show or the areas that they're going to target are going to be very relevant to interns, emergency presentations, and things that you have already studied before in your previous year topics and previous year questions. Nothing out from that. All right. So that I should be very clear with. Now, pediatrics is actually a gold mine, and I don't think you should miss out on pediatrics. In fact, there's a video that you should watch. I think there's a video by Dr. Divya on that is free, that is there on YouTube regarding video-based questions in pediatrics. Because there are multiple videos here that I feel multiple GIFs and multiple videos, and ma'am has compiled them very beautifully. So I feel you need to see that video for pediatrics and need to know a lot of these video-based questions because they can be direct questions. They are definitely going to be difficult questions, but if you get them right, they will be rank deciding for you, and they will be like I say in my other sessions, they will be super rank deciding questions for you. So just to give you a feel, of course, I have not been able to cover everything, nor do I, to be very frank and to be very honest, remember all of these things. So if you are shown a video of a neonate like this, my answer without looking at the options will be Moro's reflex. All right. That is the most likely thing that they are going to ask. There are other things like routing reflex, left, right, whatever reflexes are there. But if they have to ask one thing, and I think that is the thing that they should ask, and if you trust me, you mark it as Moro's reflex and come back home and check the answer, right? If they show you a video, you mark it as Moro's reflex. If they show you a video of neonate, I don't know what the question is, you mark it as Moro's reflex. All right. So that is what they're going to show you. I'm sure you can read about the primitive reflexes. And if they want to take it one step further, they can ask you when is that reflex lost, when does that reflex come, and all that. Right. So Moro's reflex is one thing, and the primitive reflex is one thing you should know about in this area. Second thing, again, I think I'm trying to show you a GIF. I don't know if you are able to make it out. This is not a child rolling. This is kind of a child trying to get up in the Gower sign kind of a fashion. So if you have a look at it, this is the Gower sign that is shown to you. Again, it's a very, very important video-based question. I don't think it is very adequately represented by a single image. It will also need 2 or 3 images. So they might also give this as a GIF or a video-based question. So Gower sign seen in muscular dystrophy, right? BMD, DMD. Now, these are the milestones. So I'm just trying to show a child who is walking with support. And the important thing to keep in mind, and that is where you should, be intelligent and be smart while you are studying also. Now that video-based questions or image-based questions are a thing, you should remember that milestones are of 4 types: gross motor, fine motor, social, and language. They cannot give you a social or a language based milestone in the examination as an image or a video based question. It is very difficult, unless they just want to show a child smiling. It is difficult to, provide that audio support to have monosyllable or bisyllable and all of that. So likely what you're going to be getting is gross motor, because those are the things that they can show you very easily. Child riding a tricycle at 3 years of age. Okay, it is very easy to show that. So for the examiner, it is less headache. So remember, more things are more common in the exam also and in life also. So gross motor, you should be very comfortable. Somewhat, sometimes, they can try to show you fine motor things as in a child turning a doorknob or something of those lines. But important thing is you should know the motor reflexes. So important gross motor reflexes I have put in this slide. I don't remember these. And like I told you, you refer to Divya ma'am's video. But if somebody wants, this will be there in the PDF, which I'll post it. So you can just go through the PDF and see these gross motors. And some important gross motor and fine motor, which have been asked frequently, I have, compiled here. That is at 2 years of age, 3 years of age, 4 years of age, and 5 years of age, what happens? So in this, the most common one that they can ask is child riding a tricycle at 3 years of age. If they show you a child who is kicking a ball, that is 2 years of age. That is going to, what happened. At 9 months, stands holding furniture, right? Stands holding furniture is at 9 months. That is what they can show. Or at 15 months, child is able to walk unsupported. These things are milestones that they can actually show to you. All right. So that is why this is very, very important. And that is why these pediatric milestones everybody forgets. But these are the kind of things that you have to know and have to remember one day before the exam. Do not spend too much time in sitting or memorizing mnemonics or anything. Just go through it one day before the exam and you will be comfortable through it. That I can guarantee you. Okay, that is all about pediatrics. Coming to microbiology, there is only one question that can be asked, but it is actually a good question, and it's a question that is likely to be asked. They can show you motility, right? They can show you GIFs of mainly what they can show you is the falling leaf motility. Okay, again, the way to search for this is write falling leaf in Google with falling leaf GIF with Giardia, right? And you'll get this GIF where you will see the Giardia moving around like a falling leaf in the slide. Another thing they can show you is darting motility. So if you don't understand anything, if you're not able to see anything in the video, or NMC has put up a poor quality video, but you're able to make out it is a microscopic slide, it is more likely than not darting motility, and you can mark your answer as darting motility, right? So darting motility can be shown to you. Other things, difficult to show, but you can just go through what are the types of motility. All right. So that is the only question from microbiology. Obs and gynae, I have covered one question on hysterectomy and all that can be asked in the anatomy section. They can show you one of the Leopold's maneuvers and they can ask you what is the Leopold's maneuver that has been shown to you. So just the first grip, second grip, what are the names of the Leopold's maneuvers? Just go through that once from a video based question kind of a perspective. Other thing they can show you is they can show you a video of a NST being done or a CTG being done, right? A topography being done. So that video you will be able to identify that, okay, there is a NST probe connected to the uh, pregnant lady's abdomen, and you are able to identify that it is an NST or a CTG. That is the investigation that is being shown to you. And then you can be asked a question on fetal acceleration, fetal deceleration, or something like that, right? Next, orthopedics. Actually, this is one of the places where orthopedics becomes underrated area, and everybody kind of neglects orthopedics for their NEET PG preparation. But there are multiple video-based questions and multiple things that can be asked to you. But I have stuck because I don't remember much of orthopedics. The one thing that I've stuck to and I feel that they'll ask is the anterior drawer or the posterior drawer test related to the ACL and PCL. Okay, so they can ask you any of the orthopedic tests. Actually, there are so many, and I think they are given very beautifully in BTR. So if you go to BTR on the, I think the first page of orthopedics, ma'am has given a list of tests, that are relevant here, Schober test and all of that. So just go through that. If you are comfortable with the images, a video of the test will also, you will be able to easily answer. So you can get a video based question from here. So that is the end of this video, and I think these are all the concepts, or these are all the places from where you can expect or you can get a video based question in your NEET PG examination. And I will also extend it to say in the NICT or FMG examination. I will bring you back to my rules of the video based question examination, and I will bring you back and end with this note that videos are nothing but fancy imaging. uh, Everything is fair game. NEET PG is not a screening exam. Your best friends are going to be looking at the options. Don't waste your time watching the videos multiple times just because you are, they're fancy, or, you're attracted by them. And questions will be solved by your intelligence, not merely by your knowledge. I hope this video was useful for you guys. You can find the PDF on Telegram. Do share it with your friends. It will be very helpful for them in the next 3 days before the coming NEET PG examination. And for those of you who are preparing for INI or other entrance examinations, please do share it across to your friends. Thank you so much, guys, for watching. See you guys in the next video.